All set? Good morning. I'm very happy to be delivering hopeful news and great news here this morning for the state of Washington. I'm joyous to be able to say that the federal government has authorized the use of the COVID-19 vaccine. I'm thrilled that the Washington state has now done our review and are now authorizing the use of the vaccine, and we are ready to go. We believe that we could take our first shipments hopefully tomorrow, and the first vaccinations start in our state safely as early as Tuesday. So we now are joining the powers and blessings of science with our own diligence, our own responsibility, and our own commitment to take care of ourselves and our loved ones that we have been showing in the state of Washington. The first COVID vaccine has been given initial authorization by the Food and Drug Administration, the Centers for Disease Control, and now by our own states in Oregon and California's Western State Scientific Safety Review Committee. The work group, comprised of vaccine experts from Washington, Oregon, and California, and Nevada, has been meeting to review the data and the analysis that has been released by the Food and Drug Administration and the Centers for Disease Control. And we know that after months of fighting this relentless virus, we now can begin to use this this vaccine against this virus, and add that to our tools that we have been using of acting responsibly by masking up and socially distancing, which we've been using to effect here in our state. Now, this cannot come soon enough, obviously. Our state is closing in on 200,000 Washingtonians that we know have been infected, or many more that we have not had the tests for. And unfortunately, we are approaching the loss of 3,000 Washingtonians to this dread disease. So we know there's much to do, but having this vaccine is just tremendous news for our state. Over the past few days, the FDA and the CDC have granted the initial authorization for the Pfizer and BioNTech vaccine. So I'm pleased to announce that our Western States Work Group gave their unanimous recommendation to the vaccine last night. They communicated that to me this morning, and that group is encouraging the immediate use of this vaccine. This was a 17-member work group. These members have diverse relevant expertise in medicine and pediatrics, in public health, in biostatistics, in pharmaceutical sciences, and epidemiology, and we appreciate their efforts. So they communicated this recommendation to me and the other governors of these states this morning, and Washington's representatives of the work group are here this morning. You'll hear from them in a few moments. Now, given this rigorous process, I am extremely confident that Washingtonians can begin to receive this vaccine in a safe fashion. As you know, because there had been some questions raised about the federal approval process, our state and the other states stood up an independent process so we could give an added layer of assurance to Washingtonians that this was on the up and up, that we followed standards, and we have a safe and secure vaccine. These experts, after review, advised me that the FDA followed its usual process as it normally would in reviewing a vaccine for emergency authorization. This is very reassuring to me, and I hope to others, to start down the road to recover from this pandemic. So vaccine doses, we hope, will be arriving tomorrow in the state. And again, we hope the administration begin as soon as Tuesday. Now, vaccinations will begin in our healthcare settings to our heroic healthcare workers who are most at risk to transmit the disease or receive the disease, and also to our folks in our long-term care facilities and folks in our tribal communities. Health systems and local public health departments have been working hard to prepare for this vaccine, and we appreciate their efforts, both locally and in our state efforts. This is a crucial moment. We have been waiting for months for this blessing, and it marks a turning point in this disease but we obviously know we have a long way to go. So the first good news today is the arrival of this vaccine. But after we hear from the physicians and experts about the vaccine, I'll be talking about the second piece of good news I have to share as well. I will receive this vaccine when it's my turn to do so, regarding my age and health conditions, so when it's appropriate. But as I said, the first doses are going to these healthcare workers who have stepped right into the front line of battle and shown their courage in the face of this deadly disease. And also to our long-term care residents, who we know have unfortunately been such a high percentage of our losses have been to our long-term care residents. So that decision certainly is the right one, and we're proud to make a good decision in that regard. Now, it is important to note that as it is across the United States, it will take months before vaccinations are available to everyone who may want it. We are all looking for some uplifting news during these tough times, and this is uplifting news, and it certainly should give us hope for the future. Today I'm joined by Dr. Kathy Lofi, Drs. Ed Marcuse and John Dunn, and those are our Washington experts on the Western States Scientific Safety Review Work Group. I'd now like to turn first to Dr. Lofi for her comments. Dr. Lofi.
Well, thank you, Governor Inslee. Good morning, everyone. The FDA's decision to authorize the use of a COVID-19 vaccine is just an incredibly exciting milestone in this pandemic. The news is coming at a time when COVID-19 activity is higher than it's ever been in our state. As of this morning, there are more than 1,000 Washington residents with COVID-19 in our hospitals. Our hospitals are stressed taking care of patients with and without COVID, and our healthcare workers are exhausted. We know it's been challenging to control the spread of COVID-19 this fall, and it will continue to be a challenge over the next couple months. So I'm just thrilled that we now have a new tool in our toolbox. While it will take several months to get everyone vaccinated who will want the vaccine, we can now see a light at the end of the tunnel. I've been closely watching the progress on vaccine development over the past few months. And after reviewing data from the Pfizer-BioNTech Phase 3 clinical trial last week, I fully agree with FDA's decision to authorize the use of this COVID-19 vaccine and fully support the use of this vaccine in Washington state. In addition, the process followed by the FDA and CDC to make these decisions has been open, transparent, and scientifically rigorous. At this time, I believe without any reservations that the benefits of this vaccine far exceed any risks. And I do plan to get vaccinated as soon as I'm eligible. And with that, I'll turn it back over to you, Governor.
Thank you. Dr.
Yes, thank you, Governor. As was mentioned, our work group was tasked with assessing the safety and efficacy of the COVID-19 vaccine from Pfizer that we were planning to use in our states. Both Dr. Marcuse and I concurred in the work group's unanimous conclusion that that vaccine is both safe and effective. And I would echo what Dr. Lofi said. I think its benefits greatly outweigh any potential risks. There are side effects associated with this vaccine, as there are with any other. The ones that we saw in the studies were transient, and they're comparable to the side effects that we see after administration of many other currently licensed vaccines. The clinical trials did not show signs of any other major unanticipated adverse effects that were linked to the vaccine. The trials themselves demonstrated that the vaccine is 95% effective at preventing symptomatic COVID-19 disease, which is terrific by any measure, and it frankly excites us all. The efficacy was high, we should note, across different ages and across different racial and ethnic groups. On a personal note, again, I would echo what's been said before. My line of work is the sort of thing that brings me into contact with COVID, but so does the mere fact that I am a resident of Washington State and periodically encounter people in the community. Having looked personally at all the data and reviewed all this, I can say absolutely without hesitation, I'm looking forward being vaccinated as soon as I'm eligible to do so.
Dr. Dunn, thank you. Could you just give a word of your work and your expertise in this regard?
It's relevant to this committee. I've had background working on vaccine safety studies with Lisa Jackson over at Kaiser Permanente. And my background is also in doing what we call systematic evidence reviews for the United States Preventive Services Task Force. In short, it's background in looking at studies, determining whether or not they're well done, and determining whether the conclusions that they reach are really warranted by the data that they have.
Thank you, and thank you for bringing your expertise. Dr. Marcuse.
Thank you very much, Governor. Most important, our work group concluded that the processes that were followed by the FDA and CDC committees adhered completely to their high standards of transparency, objectivity, and evidence-based decision-making. It was completely comparable to the other pre-licensing vaccine reviews by these committees that I've participated in over the past decade. And I might add that that process is really the gold standard for the world in reviewing vaccines. The difference between what we do in this country, for example, and the United Kingdom is the United Kingdom licenses on the basis of review of the manufacturer's data alone. In this country, we require that the data be reviewed independently by the FDA career staff, and our review committee had the opportunity to review the data and those two separate analyses. The process that was followed was absolutely rigorous. We think the systems are now also in place to confirm the safety of the vaccine as we go forward. This is absolutely of paramount importance to gain and sustain public confidence in the acceptance of this vaccine. And I too look forward to whenever my number comes up.
In a good way. Dr. Marcuse, could you just tell us about your background? We should have given you a better introduction.
I have been I'm a pediatrician, retired faculty at UW. I've had the privilege of being involved in vaccine work for over 50 years. I have served on prior committees, ACIP, or the Advisory Committee on Immunization Practices of CDC, on the FDA's VRBPAC, or Vaccines and Biological Products Review Committee, and as a member and chair of the National Vaccine Advisory Committee. I spent a total of about 24 years on those committees.
Doctor, could you just briefly describe what the committee did, when it started its work, and generally what you reviewed before you reached this conclusion?
So we began, about 10 days ago. We immediately worked out what our processes would be. As you mentioned earlier, it was a 17-member group with really diverse expertise. I think 9 or 10 members of the group have all past experience on these various government advisory committees, although they are independent, mostly academicians. We then had access to the data the manufacturer submitted to the FDA, these huge data files. We then, many of us observed virtually the VRBPAC meeting, again, the FDA meetings and the ACIP meetings. And then we, as a committee, met after each of those meetings and reviewed the slides and data that were presented, and then discussed each point. So it was a pretty exhaustive process.
Well, thank you. I appreciate your work. You're not getting rich doing this. This is a volunteer group, is that right?
Totally.
That is right.
Well, thank you. You'll get your reward in life for doing this great work. I just want to thank you because I think folks know that we stood up in these several states, this independent review group. And the reason is there was some concern that somehow politics would intrude in the scientific assessment of this. And I'm just thrilled to say that, and I have not been, as folks know, shy about criticizing the federal government for the last several years. But it's just really a happy event that we can say that the FDA, the CDC did their job in this case without political intrusion into the scientific decision-making. And not only that, but this Western State group have confirmed that fact. So I think this is really a gold seal of approval from the state of Washington in our own expertise. And I believe this is going to be very helpful in giving people confidence, which is necessary to the success of this vaccination program. So when we reach that golden day, when we are returning to normal, you will deserve our thanks. So we appreciate this committee helping us down the road to success of this vaccine. So thank you very much. Now, we've talked about the first piece of good news. We have a second piece of good news this morning, because we know that with this vaccine, our challenges are not at an end. We know that it will be months until everyone is vaccinated who will want the vaccine. So we know we have more work to do. And I want to paraphrase Churchill, who said, this is not the end. This is not even the beginning of the end. It is the end of the beginning. But here's the great news. We now know there will be an end to this turmoil and this trauma and this challenge. There will be an end because we know that this vaccine is going to work, both to prevent death of COVID-19 and to be safe in its administration. So we now have in view the end of this pandemic. But what we also know is that this is not the end today. We have more work to do ourselves to protect ourselves and our loved ones. But the good news is this. We have demonstrated in the state of Washington that we have the courage, we have the resilience, we have the diligence, we have the compassion for our families to actually protect ourselves during this interim period, because we have demonstrated it. We have demonstrated using masks. We have demonstrated business owners acting in consideration of hygiene. We have demonstrated it in how we celebrate holidays and how we socialize with people by avoiding in-person, inside events where this transmission can occur. So we have what it takes to marry the genius of science that is now such a blessing with our own individual behavior to see us through. But we have to exercise diligence, because I liken this to being on a ship of safety, and we now know we can see the port, we can see the safe harbor. It's in view with this vaccine. But we're not in port yet, and it is just not the moment to jump ship. We see safety on the horizon, but we all got to keep pulling on this so we can get to that safe harbor together with the minimum loss of life. But we know that we can do that because we have been doing great things in the state of Washington. I want to thank all Washingtonians who are pulling on this rope in this regard. So our safety measures will continue for the months to come, with increasing confidence that our own personal commitment and our family commitments now have added value. Look, these were the good things to do always, but now they have added value because we know that the end is in sight. And we can slow this infection rate if we keep up this fight today and in a few months to come. So as we go into the holiday season, I want to thank all Washingtonians who figured out a way to celebrate Thanksgiving safely, and thousands of Washingtonians did. We appreciate that. As you know, one national study showed that Washington led the nation in families that decided to celebrate Thanksgiving in a safe way. Now we're heading into other holidays, no matter what holiday or faith you are in. I read something that was actually in the Tacoma News Tribune, an editorial, that I just want to reference, and they talked about the season that we're entering into and how celebrating the season in a safe way, which might be a little different, was a good idea so that we can all return to our normal way of celebrating the holidays next year with the minimum loss of life. And they said, if I can paraphrase it, this is a year to recognize the original purpose of the season, to celebrate peace and quietude and the love of families. And I think if we do that, we're going to save a lot of lives in combination with this vaccine. And we know this is the gift-giving season. And we know that the best gift any of us can give is the gift of health. And that gift now, I hope Washingtonians want to give to everyone around them, families and otherwise. So this is a great day for a vaccine, but it is also a great day to celebrate what we have internally in our own hearts, which is our own commitment to save people's lives in the upcoming months. I'd like to thank everyone in the Washington State Department of Health for their tireless efforts for implementing this undertaking. I've been involved in regular briefings, and I can tell you they've been working day and night to get this job done. Leading that effort has been Michelle Roberts, who's available for questions, by the way, today. And with that, now I'd like to stand for questions, and the doctors and Michelle are also available for questions.
Up first, we'll go to Sarah Gensler with McClatchy. Go ahead, Sarah.
Thank you. This is for the doctors. There's a paragraph in your letter to the Western state governors about uncertainty around some of this, which we're all aware of, such as the duration of the vaccine's protection and its safety for pregnant women. How are you thinking about that uncertainty, and how should individuals interpret that uncertainty in the midst of all this excitement?
I think the best way to interpret uncertainty is not as a problem, but simply as things that we haven't determined yet. The things that you bring up are all things that are being investigated as part of the study that's being done. And it should be emphasized that these studies are ongoing. The fact that the vaccine has been authorized for emergency use right now does not in any way mean that any of this is stopped. All of the studies that are being done on this and on other vaccines are going to continue until all the data that they want to collect is available. For specific situations, I think that that the fact that, for example, we don't necessarily know what this vaccine means as far as transmission of asymptomatic disease or other things like that, this underscores what Governor Inslee said earlier, which is that at the immediate moment, while we have a vaccine, and this is a huge step forward, we still need to be adhering to the basics that we've been using for the last close to a year now at this point: masking, social distancing, minimizing large gatherings, etc. That's going to be important until we really have a much more developed knowledge of what this vaccine will and will not do.
With regard to the duration of immunity, the studies showed a high degree of immunity following immunization, and indeed the levels that were detected in the blood samples were beyond, greater than those following infection. So there's every reason to believe that this vaccine will provide durable immunity. Whether that turns out to be 6 months, a year, 2 years, it's too soon to tell. With regard to pregnant women, there's extensive discussion at the ACIP particularly about that issue, and we don't simply have enough data yet to have confidence but there is no reason to withhold the vaccine from a pregnant woman who wishes to receive it.
It's the ACIP here. Folks don't know that acronym.
Sorry, CDC's Advisory Committee on Immunization Practices.
Thank you.
All right, up next, we will go to Austin Jenkins with the Northwest News Network. Go ahead, Austin.
Can you hear me?
Yes, go ahead.
Oh, good. Amazing. So a question also about other groups of people who may be wary of this, in particular, people of color and marginalized communities who have historically been wary about vaccines for very good reason, and also children, especially in light of the fact that most kids are not in school today.
Doctors, do you want to address the children issue?
At this time, this vaccine has been authorized for individuals down to age 16. We need now to carry out studies to look at its efficacy and safety under that age group.
The issue about confidence with communities of color, one of the things that I was impressed with is that the focus on equity in this investigation. And I think that it has been demonstrated that the trials did focus on equity to make sure that there wasn't some unanticipated or unexpected result to any particular ethnic group. And that was really important, and it looks like they have fulfilled that mandate. We will be sharing, look, the role of government at this point is to share scientific information with the communities, and our State Department of Health will be having a vigorous communication effort to share the scientific information with all communities of all ethnicities. We know that historically there have been great concerns in communities of color about some of the really sorrowful incidents that happened in the decades past. But I think that at least the evidence I've shown or seen that there is safety throughout ethnic groups, and that we will simply share that information in as open as transparent possible, while still recognizing some of the terrible things that happened in decades past. But I am hopeful that the understandable concern from those decades of experience does not infect us with the disease of passivity and more people lose their lives. We do know that communities of color have been, which a terrible misfortune, had great disparate rates of loss. The loss of folks in the Hispanic community and the Black community of fatalities have significantly exceeded the portion of the population they represent. So the communities of color may have more at stake in some sense than other communities because they've suffered so terribly because of the disparities in where people work and access to health care. And so we are really hopeful that we have broad scale acceptance of this to save these folks in these communities, to not allow the sins of the past to result in increased rates of fatality in these communities. And we'll be sharing as much information as we can with them.
All right, up next we'll go to Jim Camden with the spokesman review. Go ahead, Jim.
Yes, Governor, I'm wondering what the priority is going to be for receiving the vaccine beyond healthcare workers and people in long-term care facilities. Will the state set up a system where a person might be able to determine when he or she might be eligible for the vaccine?
Well, what is happening is we are awaiting some further federal guidance. The national groups will make some recommendations about priority decisions going forward. We're waiting to hear from those before we make our own decisions. Those decisions have not been made to date. When they are made, obviously we will share them with the public so people can have some sense of where they might be in this queue. These are not easy decisions, as you can imagine. There are all kinds of countervailing suggestions based on our Washington values of how to go about this. And we will be first listening to recommendations from the federal government, then we will be making those more finite decisions. But when we do, yes, there will be, as much as we can, a way to convey to Washingtonians what certain circumstances will lead you to be eligible.
All right, up next we'll go to Deborah Horn with Cairo 7. Go ahead, Deborah.
Thank you, and thank you to all of the participants. I wanted to ask a question about the fact that it's not just people of color, Governor, and others who are opposed to the vaccine. There are groups known, one of them, the Seattle Truth Network, and one of the things that they're talking about is, will employers be able to force their employees to take this vaccine? What measures can be done if people say, I don't want to take it for whatever their reasons, they don't want to take the vaccine? What protection will there be for them?
Well, we'll have to give you a more detailed question. My understanding, we do not have a specific statute that addresses that issue at the moment. That could change. But right now, what we're depending on are people's voluntary decisions to protect themselves and their loved ones. And I have to say, having to look at this really extensive review of multiple scientific authorities based on the genius of science, and this has been the genius of science. Look, this is an incredible event to develop a vaccine in this length of time. And now having multiple filters, if you will, of scientific inquiry, including the FDA, the CDC, multiple committees, and now our own committee. Look, you got to understand, I've been as questioning and untrustful of this administration as maybe anyone in the country. So I've been very diligent in making sure that we look at every single decision coming through this through the lens of skepticism to some degree. So I've been in some sense, healthily skeptical. But what we have demonstrated is that there is scientific certainty about the safety of this product. And we are relying upon Washingtonians' commitment to following science and truth. And the truth is in the science. It is not in our fears. And the science, I'm hopeful, give people great confidence. And we are a scientifically oriented state. In building software and biotechnology and airplanes. Look, it was our rocket motors who has taken these spacecraft to Mars because we followed science. So right now, we're depending on the voluntary decisions by Washingtonians to marry science with the love of the people around them. Those are two powerful forces, but both are important right now.
All right. Up next, we'll go to Nick Popham with Como. Go ahead, Nick.
Hi, Governor. Thanks so much for taking our questions today. I was curious, you mentioned the vigorous communication effort that's going to be underway over the next few months. I was wondering what that might look like over the next few weeks and months as we get deeper into people getting this vaccine and then others waiting on it.
Kathy and Michelle.
I'm sorry, Karen?
Sorry, Kathy and Michelle should address that.
Kathy, Michelle, do you want?
Sure. Thank you for the question. We want to make sure every person in Washington has accurate information about this vaccine and hears about it in multiple ways. So we'll be doing lots of different strategies to share that information. We will have commercials and media information out there. We'll have different advertising. We have roundtables coming up this week with different external experts, different doctors and others to share information about the vaccine. We're doing those types of events in different languages, so people have an opportunity to hear from experts, hear the science, ask the questions they have. We also are going to make sure all the healthcare providers who will be counseling patients on when it's their turn to get this vaccine, that they have good information and that they're prepared and ready for those conversations.
Yeah, I would add that one of the reasons our state has been relatively successful, as you know, today, according to the newspapers, we have a lower known infection rate, probably better than 45 other states. And we think one of the reasons is because we've been very assertive in our communication efforts. If you're watching TV lately, you've seen multiple advertisements about this. You could anticipate seeing more about the vaccine now that we have a vaccine. And we've done it in multiple languages to make sure everyone has access, and we have done it using trusted advisors in communities to have people who actually understand the communities. And that's one of the reasons I think that we have been successful. So that will continue in regard to this vaccine.
few follow-ups.
Yeah, up next we'll go to Sarah Gensler for a follow-up question. Go ahead, Sarah.
Hi, yeah, this is for Michelle too. I'm looking for just some more specifics on these first doses. So we know an estimated 62,000 doses of this vaccine will come in an initial allocation and then expect a total of 222,000 by the end of the month. Health officials have said there's an estimated 300,000 high-risk healthcare workers in the state. So will all of these 222,000 doses go to healthcare workers initially, or will some of these go to those long-term healthcare facilities and tribal communities that the governor mentioned?
Yeah. Go ahead, Governor.
Can I say preliminarily, because it's important, the number 300,000 isn't necessarily those who are at the highest risk. And what we are doing is having the medical organizations identify those who are really at the highest risk. These are people who do intubations, who work routinely with COVID positive patients. So that term has been a little bit misunderstood in that regard.
Yeah, the other piece I'll add is that these initial doses, the 62,000 you mentioned, is going to reach over 40 or around 40 facilities in 29 counties, one pharmacy serving long-term care facilities across the state, 2 tribal nations, and 1 urban Indian health facility. So that's just these initial doses. As Washington continues to get additional allocations from the Centers for Disease Control, a vaccine over the next several weeks, we'll continue to be able to add more organizations and more counties receiving the vaccine.
We do want to make sure people understand in the real world, just because you work in a healthcare setting at this moment, it doesn't mean you're in the high risk category that this prioritization refers to. So the high risk category, those individual decisions are being made by the medical organizations, but we've made clear that it pertains to those type of working people who have the extreme exposure in these environments where they have to have aerosols when they do an intubation, or most of their day is working with COVID-19 patients. It is that group that is prioritized in this round of the priority.
All right. Up next, we'll go to a follow-up from Austin Jenkins. Go ahead, Austin.
Oh, thanks very much. Governor, could you just address the violence of the last couple of weekends in and around the Capitol and what might be done to going forward to keep future violence from happening?
Well, I have to tell you, it's maddening. It's just maddening. Here we're in the middle of a pandemic. We now have a vaccine. We have a new president. And we ought to be pulling on the rope together rather than having unnecessary fights that don't help anybody from any side of the compass. So I'm expressing great disrespect for those who are engaged in violence without benefit to anyone from any source, from any side of the ideological compass. So what we're doing is trying to diffuse tensions as much as possible. Law enforcement officers are trying to keep people apart so that their instincts don't lead to violence, and we're doing everything we can. And I just hope people will try to show a commitment to people's health right now rather than anger. That's the best thing I can say. This is a day to realize if we pull together in the country, we can save a lot of lives. And I hope people are more committed to saving lives than to taking them in the next several weeks.
One last question.
Up next, we'll go to Evan Bush at the Seattle Times. Go ahead, Evan.
Hi, Governor. Question for you. I'm just wondering what the state's long-term goals are for vaccine uptake. What percentage of Washingtonians do you aim to be vaccinated in 6 months, a year? Please just describe the goals for the early process and the long-term process as well.
Well, Kathy, do you want to talk, or Michelle, about potential percentages, realizing these are all preliminary numbers because they depend on the actual production that comes out from the producers, but do you want to give any parameters of timelines at all?
Well, I can start, and then Michelle, you can jump in if you have other information. I think ultimately our goal is to have about 70% immunity in our population. This is what experts feel is the level needed for herd immunity, which is the point which outbreaks no longer occur in a population. I think it's a little bit difficult to predict how much immunity we'll have along the way, because as the governor just mentioned, we're not 100% sure of the vaccine supply going into 2021 at this point. In fact, I don't believe we've received very many estimates from the federal government around how much vaccine we will be receiving. And we also don't know the uptake. We really hope that people will, choose to get vaccinated. We're very confident about this vaccine, but I think that is to be determined as well.
One wonder in our ability to obtain the immunity we need to break the transmission chain. Natural immunity will also be of benefit. So in the upcoming months, we will have increase in immunity both because of the vaccine and because of folks who unfortunately have positive COVID numbers. Now we're trying to keep that one down as low as humanly possible. And I just hope everyone can add to that great national effort.
We've got time for one more follow-up. We'll go to Deborah Horn with Cairo. Go ahead, Deborah.
Thank you so much. I wanted to know what effect will the potential extraordinary emergency use authorization that may come this week with the Moderna vaccine, how will that affect the number and use of vaccines in this state? And will you do the same thing with that you've done with the Pfizer vaccine?
Yes, you can anticipate similar process with similar rapidity, which we're really, really happy about. Michelle, do you want to address potential dates in that regard?
Yeah, we are really looking forward to the federal review of the Moderna vaccine this week as well. The Independent Advisory Committee of the FDA is meeting on this Thursday, December 17th, to review that vaccine. And then we will anticipate the same steps will follow. Our Western State Committee will review that the CDC Advisory Committee on Immunization Practices. And then if the FDA does make an emergency use authorization, that vaccine would start flowing into our state the week of December 21st. We are really excited about the potential for the Moderna vaccine. There's just less logistical barriers with the Moderna vaccine than with the Pfizer vaccine. And our initial allocation is much higher. It's 128,000 doses if that vaccine receives FDA authorization for the first week, that week of December 21st in Washington state. So we'll be able to get that vaccine to a much broader reach across the state.
My final sentiments are that the enormity of this success cannot be overstated. Just this past February, you could have become a very rich person betting, that this was going to become available in December of 2020. It is an enormous scientific achievement, and it is a gift. It is a gift of intellectual capability, entrepreneurial zeal, a lot of hard work, a decision by the federal government to invest in this at the same time it was being approved to actually manufacture it. All of these combined in a tremendous achievement. And to not use it, we just can't allow that opportunity to go unanswered. So I'm most hopeful that we follow the science, we receive the vaccine, and while we're waiting for its total application, that we're all safe this holiday season. It is a wonderful holiday season in the sense that in the darkness of the year, we have this bright light of recognition that we have the end in sight for us. And I hope everyone will take an opportunity to use those great gifts that we have, the gift of the vaccine and the gift of our own diligence. Those are going to do good things to save lives in this state. With that, please be safe.